Hello, everyone, and we're glad you can attend Attitude's weekly ADHD Experts webinar. We hope that everyone is staying safe and staying well as we approach summer. A little housekeeping before we get started. If you've listened to one of our webinars before, you know we offer attendees a certificate of attendance. When the webinar ends, a post-event survey will pop up. It will list 3 questions about the quality of the webinar, followed by 3 questions titled Required for Certificate. If you would like a certificate of attendance emailed to you, you should answer those 3 questions. If you don't want a certificate, well then don't bother. Also, the sponsor of this week's webinar is Play Attention Virtual Summer Camp. For over 25 years, Play Attention has been helping children and adults thrive and succeed at school, home, and work. Their NASA-inspired technology and cognitive exercises improve executive function and self-regulation. Each program includes a lifetime membership and a personal executive function coach to customize your plan along the way. Call 800-788-6786 or click on the hyperlink on your screen for free virtual summer camp and take the Brain Boost Challenge. Children and adult campers welcome, free consultation available. Attitude thanks our sponsors for supporting our webinars. Sponsorship has no influence on speaker selection or webinar content. Now, today's topic is an important one for adults and children diagnosed with ADHD. So many people in the Attitude community are looking for tips and strategies to help them get a sound night's sleep. We know that sleep is key to memory, the health of our brains, and of course our bodies. Research even indicates that an insufficient amount of sleep may lead to obesity, as well as heart and blood pressure challenges. So what is it about the ADHD brain that creates problems getting to sleep and staying asleep? I know lots of people diagnosed with ADHD want to know the science behind that question. We have Dr. Mark Stein here today to give us some understanding about sleep and ADHD. Mark directs the Pearl Clinic at Seattle Children's Hospital and is a professor of psychiatry and behavioral sciences and pediatrics at the University of Washington. Dr. Stein received Chad's Lifetime Achievement Award in 2018. Mark is an active clinician and researcher who has studied the impact of ADHD treatment on sleep. You can ask questions of Mark during his presentation, and we will try to get to as many of them as we can after he finishes. If you want to download the slides of the webinar, click the drop-down menu labeled Event Resources on the bottom left of your screen. If you do not see the Event Resources tab, you need to refresh the page. That all being said, I'll now turn it over to Mark. Thanks for being here today, Mark.
Great. Thanks, Wayne, and thank you all for tuning in. Just to kind of go over the agenda for today, I'm going to talk a lot about different studies that I've done and other colleagues have done and kind of what they've taught us about sleep and ADHD. I hope to review how common sleep problems are in people with ADHD, the types of sleep problems, how we assess them, and especially I'm going to talk about the effects of ADHD treatments. Turns out that all the things that we do to help ADHD, medications, behavioral therapy, cognitive therapy, they all have effect on sleep and vice versa. So I'm going to talk about that. And I'm going to end by talking about different strategies to address sleep in people with ADHD. So just to start, I wanted to present a typical case. And the idea of this is to get you thinking about the complexities of ADHD and sleep. This is a boy, let's say a 10-year-old boy, we'll call him Max. And he had been diagnosed with ADHD about 2 years ago, and he's been treated with a methylphenidate stimulant. And that's really helped him do better in school. He's much more on task in school. However, in the late afternoon, he gets really tired and irritable. And his parents say that he's increasingly hard to wake up. They keep buying louder alarm clocks, and it's resulted in quite a bit of family conflict in terms of, is he staying in bed for purpose, and is he, parents will yell at him to get out of bed. The parents feel that they're often late because they have to spend so much time waking up the child. You notice when he comes in your office that he has dark circles under his eyes, kind of a signal that he's not getting enough sleep. And then you ask about, kind of what's going on at home, and you find out that there's really no consistent bedtime. His parents divorced about a year ago, and they share custody, and they have different rules in terms of schedules and bedtimes. And the family also has some financial difficulties. Their work schedule has changed, and so it's harder for them to put him to bed at a consistent time. And he's starting to have social problems. Peers are not calling him to do things except for online video games. He's not been able to participate in sports. And he's starting to realize that he's struggling in all these areas and making negative comments. So this case, it just meant to highlight the relationship between sleep, attention, and kind of family factors, and how ADHD presents both in terms of a variety of different symptoms, but also throughout the day. It's not just, ADHD is not just a school disorder. The 24-hour schedule is what's really important. So now I just want to give you a little historical perspective on the relationship between ADHD and sleep. And Dr. Samuel Cortese, who's a child psychiatrist in the UK, has written extensively on this. And basically he says that it's not really novel or new at all, that people have been looking at ADHD and sleep for some time. In his article, he cites Loffer and Denhoff, who talked about the problems that parents of children with ADHD have at night are more severe than the ones in the daytime. And even though sleep problems are really common in ADHD, they actually were part of the diagnostic criteria earlier. The DSM, or Diagnostic and Statistical Manual, is what we use as the definitions for psychiatric disorders in the United States. And now we use something called DSM-5. But in 1980, we had DSM-3, which actually listed moves about excessively during sleep as a symptom of ADHD. There are also several disorders similar to ADHD which have a more central role for sleep. There was a neurologist named Warren Weinberg that talked about people with primary disorders of vigilance who had attention problems, daydreaming, and sleepiness. And within the ADHD scientific community, there's something called the sluggish cognitive tempo phenotype, which is thought to be a subgroup of people with ADHD, who among their symptom lists include being tired and lethargic. So really there's a long history of overlap between ADHD and sleep. Early in my career, when I was at the University of Chicago, I was fortunate enough to work with several sleep researchers, including Dr. Alan Rechtschaffen and Dr. Ruth Benka. And they encouraged me to study sleep problems in children. The bulk of research on sleep in psychiatry had either been done on adults or had been done on preschoolers, and there was this big gap in terms of elementary school children. So we did a study surveying sleep in children receiving pediatric care, and what we were surprised to find, was that sleep problems were common in elementary school-age children. 10 to 15% had sleep problems, and yet they often didn't talk about it. Parents didn't discuss it with the pediatrician. We also found that sleep problems were related to behavioral and attentional and emotional problems, and so they were a good marker. So later in my career, when I focused more on ADHD, I asked the question, is there something about ADHD that puts you at higher risk of having sleep problems? So what you see on this slide is from a study that we did. This is a cross-sectional observational study where what we did is we looked at children that were coming into various clinics, and we had the parents fill out a questionnaire about sleep. And the simple question was, does your child take longer than 30 minutes to fall asleep? And then if so, is that once or twice a week? Is it every night, or is it never? And so what you see here on the bars are the percentage that had nightly insomnia. In other words, they took more than 30 minutes to fall asleep each night. So what really stands out is when you compare the orange bar to the yellow bar. The orange bar are children with ADHD taking medicine, and the yellow bar are children with ADHD not taking medicine. You can see about a third of those taking medicine had nightly insomnia versus 10% of those that just had ADHD. And then for comparison, the green and blue are just children either with other psychological problems besides ADHD or children receiving routine pediatric care. So basically this suggests that having ADHD puts you at risk for nightly insomnia, and then having ADHD plus taking an ADHD medicine puts you at much greater risk for having sleep problems. So this kind of got us started on several studies where we actually looked at sleep problems as an outcome. In contrast to an observational study, what's called a randomized controlled trial, where actually you treat somebody and you can make a direct comparison, and you can really learn more about the effect of the intervention. So this is a summary of a study that I did with Dr. Jeff Newcorn at Mount Sinai Hospital, where we compared the effects of a common ADHD medication, long-acting oros methylphenidate or Concerta, with a non-stimulant, atomoxetine or Strattera, and we also looked at sleep problems at baseline. So I want you to look at the first column on the left, and if you look at the percentage in black, 35%. So these are children that are good sleepers that don't have nightly insomnia. So you can say that when you look at the population of ADHD youth, about a third are good sleepers. But when you look at the top in the blue categories, about 19-20% had nightly insomnia even before taking medicine. So again, just having ADHD puts you at risk for having difficulty falling asleep at each night. So the other columns give you an idea of the effect of medication, but here in this study, the effect is evaluated after being treated for 5 or 6 weeks to an optimum dose. And what you can do is you can compare 19% to 23%, and that's the difference between taking medication or not. So in this case, when you take methylphenidate stimulant, you have a slightly higher rate of nightly insomnia. But there's still a good percentage that are good sleepers no matter what. And the third bar shows you the effects of atomoxetine on nightly insomnia. And here actually we see a benefit where the number of children having nightly insomnia at the end of the study was a little bit under 12%. So overall, what we found was some people have sleep problems regardless of medication. Slightly more of them have sleep problems when they're taking a stimulant, methylphenidate, and slightly less of them have sleep problems when they're taking a non-stimulant, atomoxetine. So what are the types of sleep problems people with ADHD have? Well, as I said before, delayed sleep onset, whether we call that insomnia or sleep onset latency, that's the most common sleep problem we see. And again, that happens in 10 to 30% of children with ADHD. Related to having a difficulty falling asleep, they sleep less. So they have decreased or inadequate sleep. And what happens is if you have decreased or inadequate sleep at night, your body tries to catch up with you during the day. And so you see hypersomnia or tiredness during the day. So those are very common in people with ADHD of all ages. We also see nighttime waking, where people will have more frequent wakings. And a very common characteristic of people with ADHD is what we call night-to-night variability. And this is a circadian disturbance. And what happens is your body gets used to different patterns. And when there are disruptions in the patterns, your body is slow to adapt. So for example, an example might be someone that goes to high school and has to get up very early while their body isn't ready to be awoken yet. Their brain isn't working. And they may not wake up till later in the day, but unfortunately they have geometry first thing in the morning. And we can make this worse in people with ADHD when we have inconsistent medication schedules. For example, if you only take a medicine 5 days a week, or for example, if you sleep late on weekends and stay up extra late, then Monday morning is going to be very difficult. So these are kind of the big, or the most common sleep problems we see in people with ADHD. I also want to mention what we call primary sleep disorders. So primary sleep disorders are actually disorders that can mimic ADHD symptoms or make them worse. And they should be ruled out before diagnosing anyone with ADHD because some of the symptoms may be due to those disorders. One of the most common is sleep-disordered breathing. Someone that basically their breathing isn't interrupted at night. There's less oxygen in the brain going to the brain, and it affects their functioning and puts them at risk for a host of medical and psychiatric problems. Another primary sleep disorder is restless leg syndrome. People feeling creepy, crawly sensations in their limbs, kicking the bedclothes off, even pain and discomfort. So those are primary sleep disorders that need to be ruled out. The first primary sleep disorder that was identified was what we call Pickwickian syndrome, which is a subtype of obstructive sleep apnea. Pickwickian syndrome, this is a picture of Charles Dickens, and in his book, The Pickwick Papers, he described Fat Joe, I think it was in the 1830s. And Fat Joe was this jovial person who was obese, but would sleep during the day, hard to wake up, had a red face, loud snoring, and really struggled with school. So this is kind of a caricature, but kind of alerts one to, again, how long there's been this awareness of how sleep affects your attention and your learning. So getting back to ADHD medications and how they affect sleep. So we've already shown that taking an ADHD medicine, particularly a stimulant, puts you at risk. But we wanted to learn a little bit more about what exactly causes that. And so this is a study that we did with a long-acting methylphenidate, oros methylphenidate, where we had children with ADHD, and they were each treated with a week on a low dose, 18 milligrams of methylphenidate, a week on a medium dose, 36, and a week on a high dose, 54. And what you see, this is what we call a linear dose response curve. The higher the dose of stimulant, the more likely they're going to have nightly insomnia. So at the highest dose, about a quarter had nightly insomnia, whereas at the low dose, it was very similar to baseline or placebo. Now, the important thing about ADHD, though, is titrating medications to get what we call the optimal response, where you reduce the ADHD symptoms. And that also displays a linear dose response curve. So the tricky thing is you get the best response usually at the higher doses, but higher doses also lead to more side effects. And so for each individual patient, the key is finding the dose that helps them the most without causing significant side effects, in this case, nightly insomnia. Now, one of the caveats is everyone was only on this medicine for about a week. And so when we're evaluating dose, we're also evaluating it at a short time period. In the study that I showed you earlier, the rates were lower, but that's because they were evaluated 4 or 5 weeks. And in fact, many children that have initial sleep problems get used to that, and that they improve several weeks later in cases where the sleep problems are mild or moderate. So I wanted to talk just a little bit about how sleep problems are measured. The studies that I've been talking about so far have relied on parent report and questionnaire. Those are called subjective measures of sleep. But we also have objective measures of sleep. Objective measures of sleep may include what we call polysomnography or actigraphy. And this is one of the first studies that I did using actigraphy, where children wore a very kind of fancy wristwatch that measures how often they move. And by using this, you can track movements which correlate with their sleep. And in this study, this is a study of immediate release methylphenidate or Ritalin, and children were tried on, they spent a week on placebo, a week where they were titrated to an optimal dose, and then a week where they received Ritalin twice a day at 8 and 12, and a week where they received it 3 times a day at 8, 12, and 4. And what I want to highlight is that the parent ratings, and this is a low dose of Ritalin, really didn't show any difference in sleep problems. About 20% had nightly insomnia at all doses. But when you use the objective measures, the actigraphy, even on this low dose, what we found was that taking a stimulant kind of increases or doubles your risk for having excessive nighttime insomnia. Now, in this study, interestingly enough, we didn't find a difference between taking a third dose and taking a second dose, but the caveat is that these were really low doses. And I think if the doses were higher, probably the rates would have been somewhat higher. But again, I think the takeaway is that it really depends how you measure sleep, and there are differences between subjective and objective reporting. And what people report and parents report often doesn't agree with objective findings. And so that needs to be taken into account by the clinician. So far I've been talking about the effects of treating ADHD with methylphenidate stimulants and with atomoxetine or a non-stimulant. But many people, especially adults, are now treated with amphetamine stimulants. And so one of the questions is there a difference in the effects on sleep between methylphenidate and amphetamine? So here, this is a study of comparing methylphenidate and amphetamine, and this is actigraphy. And what we're looking at is the differences in sleep duration at placebo and baseline to when they're taking 10, 20, or 25 or 30 milligrams of either, in this case, dexmethylphenidate or mixed amphetamine salts. And what you can see is that at the higher doses, children had less sleep. The duration was less. And it's a little bit more of a linear dose response curve, especially for amphetamine. Now, on the subjective ratings, at the group level, there wasn't a difference between methylphenidate or amphetamine except the low dose level where amphetamine had more of an effect. So in general, what we can say is that all the stimulants affect sleep in many children, especially in the short term, especially like the first week or two that they're treated, and that it correlates with dose, but that also correlates with efficacy. So again, you want to find that optimal dose where you get optimum efficacy without affecting sleep adversely. So now let's just kind of summarize what are the reasons why sleep problems are so common in ADHD. So to begin with, let's just talk about characteristics in the child or in the adult with ADHD, and let's just think about what are the biological characteristics. Well, certainly if you have obstructive sleep apnea, let's say you're snoring, let's say you have enlarged tonsils or adenoids, that's going to affect your sleep, and that's going to affect your attention. Similarly, if you have restless legs, that's going to affect you. Now, those are all treatable, and there are medical treatments for those things, which one should be identified before treating ADHD, and in some cases may reduce ADHD symptoms. In addition to the characteristics in the child, the history of the child in sleep is important. Their history of sleep problems. So someone that has sleep problems to begin with, and then you start an ADHD medication, that puts you more at risk to having more sleep problems. If the child has never learned to settle, to sleep in their own bed at night, to calm themselves when they wake up and have a nightmare, again, they're going to have more difficulties when ADHD is treated. So those are characteristics not necessarily related to ADHD. Thinking about what's related to ADHD, however, it makes sense that there are characteristics, what we call the ADHD brain. A kind of a typical example would be what the ADHD brain is someone that is thinking a mile a minute and just can't get their mind to quiet. They can't get themselves to calm. And so this is counter to falling asleep, where you need to do that. The other aspect of people with ADHD is poor time management. We talk a lot about executive functioning. And so not getting things done on time and then rushing to get them time because they procrastinated, being stressed by that. And then before bed is when people kind of think about those things, which can cause distress and kind of delay them being able to relax and achieve sleep. So this difficulty shutting down the brain, calming it prior to sleep, especially if they're disorganized, they're rushing to get through the day, catching up, and then kind of forcing sleep in a narrow window, and it just doesn't work that way. As you know, most ADHD usually doesn't come by itself, what we call ADHD simplex, but 70% of the time ADHD occurs with other problems, other medical disorders and other psychiatric disorders. And many of the psychiatric and medical disorders associated with ADHD also affect sleep. So we have, in children, psychiatric disorders like anxiety. So a child doesn't want to go to sleep because there are monsters under the bed, or they're worried that someone's going to come in and attack them. Or maybe they have OCD and they're making lists at night and thinking about germs or things that they can't get out of their mind. So anxiety and ADHD can impact their getting to sleep. One of the most common comorbid psychiatric disorders in children with ADHD is oppositional defiant disorder. So if a child hasn't learned to listen to a parent and they would much rather play or be online, and the parent says, okay, you need to go to bed, that's not the time they're going to listen. And the parent isn't equipped or hasn't learned how to make them listen. So oppositional defiant disorder and anxiety make it much more difficult for kids with ADHD to learn to fall asleep at night. Now, shifting to adults or adolescents, we think of the comorbid conditions like depression, anxiety, PTSD, substance use disorder. All those disorders have an effect on sleep, whether it's sleep onset or more nightmares or difficulty waking up after a few hours if you've been drinking alcohol. All those things are going to kind of put you at greater risk. And then thinking about what can be done about sleep problems in families with ADHD. So these are what I call parent-mediated factors or individual-mediated factors. So clearly medication is something that needs to be evaluated. And let's say, like the example I gave you with Max, where he's having an optimal response in terms of his school day, but not in terms of the afternoon and not in terms of the evening. So really talking to your doctor about what is the right medication regimen. And it may not be one medication taken once a day. It might be several medications. But basically finding the dose that treats your ADHD symptoms when they are most impairing without exacerbating sleep problems. And so you want to look at the dose, you want to look at the dosing schedule, including the timing, the duration of the medication effect and the duration of the sleep effect. And if it's a new drug or it's a short time on dose, have you been on it long enough to accommodate to that dose? And then, of course, the consistency. Are you taking the dose every day? Or if this is your child or adolescent, are they non-adherent, which means that they're frequently having to get used to the drug all over again, which may exacerbate some of their difficulties. In addition to the medication, you want to think about the environment, the family environment, and the psychosocial interventions. Certainly looking at the physical environment. Does the child or does the person have a bed in a quiet place? Are you able to block out light? Is it temperature? Is it cool enough to fall asleep? And then again, looking at the child's activity level and their schedule through the day. You don't want the child to have a vigorous aerobic activity right before bed. You also don't want the child to be playing an exciting game in their bed, because then they think that their bed is a time to play. But having a routine where you basically have the child settle down for some time before they go to bed. And bed is the place that really, sleep is the main activity in bedtime, and they should go to bed when they're tired. So, playing games should happen before then. Maybe having a quiet reading time is a good idea, or a bath. But having a set schedule and a set bedtime is very helpful. And going over the sleep schedule. And we like to limit screen time, especially before bed, not allowing that an hour or two before bed. And then parents and other family members have to set the right example. Parent sleep problems predict child sleep problems. So if the parent is, has an erratic sleep schedule, they're not modeling what they want the child to do. So again, striving for consistency and routines. So in terms of what to do if your child has ADHD and they're on a medication, we've developed some guidelines for providers in terms of a strategy. And this is from a chapter in a book on ADHD and sleep that basically says monitor sleep problems before starting an ADHD medicine, but even as part of the diagnostic evaluation, first making sure that there's not a primary sleep disorder. So if there's any suggestion of obstructive sleep apnea, they should be referred to a sleep medicine individual for a sleep study. And that information comes from the sleep history. We often use a questionnaire called the Sleep Habits Questionnaire just to screen for baseline sleep problems. Then when medication is started, you want to keep measuring sleep duration, how long it takes to falling asleep. And you also want to make sure that individuals practice good sleep hygiene, that they minimize the amount of caffeine or other stimulants, and that they try to be as consistent as possible in their medication use, in their schedule. And then if sleep problems occur, the first thing to do is to look at the medication dose. And then if the dose adjustment doesn't work, then think about trying a different medication, again, within the context of always practicing good sleep hygiene. And melatonin is something that is being increasingly used for people that have difficulty falling asleep. And it's used as a hypnotic where it's given usually about a half hour before bed, and that can help kind of reduce the latency to sleep onset. So in summary, we want to think about ADHD not as just a school disorder, but as a 24-hour disorder. And their sleep functioning is relevant to their daytime functioning. We realize that stimulants can make sleep onset latency worse and decrease sleep latency. So it's important to monitor that and come up with the optimal solution. Recognizing Dr. Ruth Gruber and others have done studies where they've shown the impact of just missing an hour of sleep on your attention and on your mood, and it's very dramatic. So again, striving for consistency and making sure everyone gets adequate sleep can have a major impact, not just on their ADHD symptoms, but also on their mood symptoms. So trying to strive for this consistency and reducing night-to-night variability. And, kind of I guess the most significant advice is not to just focus on medicines and ADHD symptoms, but to focus on your lifestyle. Increasing activity level, minimizing screen time, being out in nature, sports. These are things that both help sleep, but they also help ADHD and they help mood, and they don't have negative side effects. So in all cases, we should be looking at what are these positive health behaviors, and we want to increase those while decreasing negative health behaviors such as screen time or sedentary activities. So I want to stop now and hopefully get to your questions. But what I've tried to do is give you a sense of what we've learned about sleep in individuals with ADHD, kind of how it's measured, and the impact of different treatments and lifestyle aspects on ADHD. I do have a disclosure slide. I wanted to mention that I consult for several companies, and I also do research on several ADHD treatments. Thank you.
Okay. Thanks, Mark. That was great. Several parents have asked, because not all children are being medicated. And one mom asked, my 5-year-old son is not on medication, but really struggles to fall asleep at night. Sometimes we will forego a nap to help him fall asleep more quickly at night. But as a result, his volatility and aggression during the early evening is at an all-time high. Any suggestions on how to balance this?
Yeah, well, medicines are helpful, but they usually don't cure ADHD, and we usually don't recommend them until, they're most effective in children 6 or older. So the first-line treatment for ADHD and associated behavioral problems are really behavioral strategies. And so if you have a 5-year-old, for example, I think the goal would be to try to teach them to fall asleep in their own bed and to have an adequate amount of sleep. And what we often recommend is what's the behavioral parent training, which would be meeting with a therapist or a psychologist to learn strategies. There are some things that you can read. There are online sources, but basically what these programs involve is kind of developing a systematic rewards for staying in bed longer, and doing the things I mentioned before about making sure the child doesn't get super active right before bed, avoiding caffeinated beverages, those kinds of things.
Mm-hmm. The data on the stimulants and dosage and sleep challenges, do they also apply to adults? Or is it a different story for adults, or how does that work?
Yeah, well, there are fewer studies of sleep in adults. The studies that are out suggest that it's a little bit less of an effect. The adults tend to tolerate stimulants, I think, a little bit better than kids, but you still have, insomnia is still the most common side effect that you see related to stimulants. And so I guess I would extrapolate from the child data to adults, but just to a lesser degree. The other thing about adults is they're able to kind of report on their sleep a little bit more accurately than kids. And so I guess they can track it, and then you can modify their dosing schedule based on that. But it's important to share that information with your doctor about your sleep.
Mm-hmm. One woman has inattentive ADHD, and she wanted to know, do the sleep patterns change during menopause? I don't know if this is something you could address or...
Yeah, I don't think, I'm not aware of any studies on that, so I can't comment.
Okay. Some parents have suggested or tried using Benadryl to help their child sleep. You were talking about various medications. Where does that sort of fall into the spectrum?
Yes, so that's something that we don't recommend, although that's something that has a long history. So antihistamines are sedating. They kind of make you tired initially. And so it might help you fall asleep, but they tend to have a long half-life, and they tend to make you sluggish when you wake up in the morning. So it's not a good long-term solution. So we do recommend sleep hygiene or melatonin as a first step. And then if that doesn't work, we recommend talking to your doctor about a different sleep medication, but not an antihistamine. I mean, they're available, they're over the counter, but we think they're often misused to treat sleep. And it'd be much better to actually teach someone to be a good sleeper rather than to give them antihistamine to cause that effect.
Mm-hmm. Several parents have talked about with their teens using a sleep coach. I don't know if that's the right term, but a sleep counselor. And several people have said it's been extremely successful. So I wondered what a sleep counselor actually does.
Well, if they're doing sleep hygiene and behavioral treatment, then that would be very effective. So if they're helping the family develop consistent routines, having a media plan, developing a kind of a structured approach to learning to fall asleep and be consistent, those are all positive things.
Mm-hmm. When should a parent think about perhaps having a sleep study done for her child?
That's a good question. Well, they should discuss it with their pediatrician, but usually the reasons to do that is if one suspects that they have sleep apnea. So if they're snoring, if their tonsils or adenoids are enlarged, if they've tried a number of things and they haven't worked, or there's something really unusual in their sleep pattern. But we don't generally recommend sleep studies for behavioral insomnia or difficulty falling asleep initially. It's more for snoring or where we're concerned they might have sleep apnea or restless legs, I guess would be another reason.
Mm-hmm. Can, another mom is asking, can food dyes have an impact on sleep? Are there any studies on that or just anecdotal stuff?
There are a number of studies that have been done in ADHD children on food dyes, and what they basically show is not much of an effect on ADHD symptoms. Now, if you have a child that has, and this is rare, but some children have food allergies and sensitivities, and they might have a lot of allergic symptoms like hives and things like that, and anything that suggests they have significant allergies, or for example, if they're having trouble breathing, that's going to affect their sleep. So again, those are things to discuss with their pediatrician. But in most cases, the food dyes haven't been shown to have much of a relationship with behavior.
Mm-hmm. What about the medication clonidine? Is there any positive effects on sleep?
Yeah, so I didn't talk about that, but clonidine is it's what's called an alpha-2 agonist, and it's a non-stimulant, and it has a long history of being used to help with sleep onset because it kind of makes you kind of slow down and makes you tired. One of the main side effects of clonidine and the other alpha-2 agonist is called guanfacine. 20 to 40% of children that take those for ADHD have tiredness or lethargy or fatigue, which kind of helps you fall asleep. So it's been shown to be effective in helping with sleep onset. and it's effective in use with ADHD. And actually, it works quite well when administered with a stimulant. There are studies that show that when you take a stimulant during the day and an alpha-2 agonist at night, like clonidine or guanfacine, your ADHD symptoms might be better at a lower dose, and you might not have as many side effects. So these are the kind of the options and things to discuss with your child's doctor.
Mm-hmm. Yeah, you had mentioned non-stimulants versus stimulants on that graph there. And one dad is asking, if you were to switch to a non-stimulant to address sleep issues, would it negatively impact the effectiveness of taking medication to control hyperactivity? So I guess...
Yeah. So I think the non-stimulants like atomoxetine are effective in ADHD. Most studies show that they're a little bit less effective than the stimulants, but they work in a different way and they have a slightly different side effect profile. So for someone that has ADHD, that stimulants really make their sleep worse, a trial on atomoxetine is a good idea.
Mm-hmm. Yeah, sorry for this grab bag of questions. A lot of people have some very interesting. Okay. How does the circadian shift during adolescence come into play here? A lot of people are saying, do adolescent ADHD brains face certain challenges that, adults and younger kids don't?
Yeah, well, they do. And adolescents are so challenging to treat because the adolescent brain, the adolescent schedule, everything is different. They have more demands for academic work, they're more independent, and they're more involved in their health care. So it's really, and one of the things I should mention is that adolescents with ADHD tend to view ADHD differently than school-age kids. And they have different concerns. And so it's really important when working with an adolescent to get their view of what's important to them and to have them involved both in selecting the medication and monitoring the medication to make sure it fits their schedule. So, for example, an adolescent that's, concerned about sports or concerned about weight, they may not want to take a stimulant if it has that side effects. So finding the right stimulant and the right dose that helps them with what they feel is important without causing significant side effects is really crucial. And many times it's really different from what we see in children. And because of that, adolescents are often non-adherent with medication and often discontinue it, and then they get into serious trouble. So I think it's a really challenging population to work with and a really important one.
Mm-hmm. Is there a link between stimulant medication and restless leg syndrome?
If there is, I don't know what it is.
Okay. Yeah,
it's an area that we need to learn a lot more about. Most of the restless leg research has been in adults, and we're just starting to look at it in kids. And actually, we're involved in studies of restless sleep, which is kind of a new subtype. And we think it's very high in individuals with ADHD, and we're trying to kind of learn more about that. But not much is known yet.
And the dosing of melatonin. Lots of people think the more the better. Then there are all these various articles about going between 1 and 5 milligrams. So where do you come down, or what would you suggest for people who are just going to open a bottle of melatonin? Yeah,
so a couple of things about that. One of the issues with melatonin is it's a supplement in the United States, so it's not regulated by the FDA. And what that means is that there's a lot of variability in different melatonin formulations. So we can talk about dose, and usually the recommended dose for difficulties with sleep are 3 to 5 milligrams about a half hour before bed, starting with a low dose and then increasing it. But there's huge variability. Sometimes people will get formulations that have very little melatonin in them. And the other issue is whether it's immediate release melatonin or delayed release melatonin. Sometimes melatonin can help you fall asleep, but then you wake up later. I think I would urge people to be cautious in terms of the formulations that they get. And if it's not working, they might want to, talk to their doctor about ones that other people have had good experience with. And also about melatonin, it's important that it be stored in a dark room. If it's exposed to light, it can be deactivated. Again, there's a lot of variability in terms of where the melatonin comes from and what type it is. But usually people respond in terms of being tired and ready to sleep at those doses of 3 to 5 milligrams. Now, melatonin is also used to advanced sleep stages, and in that very low doses are used, but that's really much more complicated, and that's usually done in consultation with a sleep medicine professional.
Uh-huh. And does melatonin guarantee good sleep quality? I mean,
Yeah. That's related to what I was saying about waking up earlier. Like sometimes it can alter your what we call your sleep structure or your sleep.
Right.
You can have more fragmented sleep, and you could wake up. You might fall asleep, but you might wake up more often. So that's why it's important to look at what type of melatonin it is.
Uh-huh.
So you might fix one sleep problem, but develop another sleep problem.
Right. Lots of parents asking about which is the common complaint about children not being able to turn off their brains, and also the component of anxiety. I wonder if there are any strategies to sort of lower the levels of anxiety within the sort of the ballpark of going to bed.
Yeah. Well, again, it depends on how severe it is and how impairing it is. But cognitive behavior therapy is an effective therapy for anxiety in children, and basically teaching children to control their negative thoughts. And I guess as parents, one thing to do, if you have a child that's a worrier, unfortunately, children that are worriers often have parents that are worriers also. And so coming up with some ground rules for talking about worries, but making bedtime not the place or time to do that. So you could say, at 10 to 10:30, we're going to talk about all the things we're worried about, and certainly you can come up with a long list now.
Yeah.
But starting at 8 o'clock, we're not going to talk about any of those things, and instead we're going to listen to quiet music, or we're going to, read a book and talk about that. And then rewarding those successes in terms of being able to keep to that schedule. Trying to master the anxiety, not letting the anxiety master you, and keeping it out of bed and keeping it out of sleep. And then I guess also thinking about things like nightmares. You don't want the child to learn that every time they have a nightmare, they can come in their parents' room and sleep in their parents' bed and get lots of reassurance, because then they're going to get more of that, and they're not going to learn how to deal with their anxiety. So again, you want to teach children to be brave, and the way to do that is by using rewards and by modeling. Again, that's something that you can get help with a mental health professional talking about cognitive behavior therapy for anxiety.
Mm-hmm. Then there are those sort of mechanical devices, white noise, and are there any apps that perhaps you would recommend that put a kid in a good state of mind for sleep? Or an adult?
So I was going to say, I personally recently purchased a white noise machine. I had one in my office for psychotherapy sound reasons, but I got one at home, and it's made a huge difference in terms of nighttime. Blocking out, I live downtown, and there's a lot of ambient noise, and it really has made a dramatic improvement. And you can adjust it, for different sounds. So I personally recommend it, and I think that's an easy thing, an easy fix.
Mm-hmm. And what about how accurate are some of the sleep monitoring devices if someone resorts to seeing how their sleep went? Like Fitbit or similar wearables, is that worth doing, or any you can recommend?
Yeah. Well, it's kind of like the melatonin story. It's like they're so variable. There's so many different ones, and most of them have not been scientifically validated. But I mean, I think if you have one, I would use it and see if it's helpful. I mean, again, for comparing your sleep, I think it's always good to be able to monitor it. We rely on these things called sleep diaries, which are not that reliable. And so I think it's good to look for objective measures as well as subjective measures of sleep to help monitor that.
Mm-hmm. How does, you might have mentioned this in the studies you quoted, but how does sleep apnea affect ADHD symptoms?
Well, if you're, I guess thinking about sleep apnea, it affects you're going to be tired during the day, and you might be more hyperactive because your brain is not getting enough oxygen, and then it affects so many different functions. So it affects it mimics ADHD actually, and so that's why we want to rule that out and have that treated first.
Mm-hmm. And is sleep disordered breathing the same thing as sleep apnea? A couple people wanted that clarified.
Yes, it's just a different. I mean, they're different labels, but they overlap they're the same class of problems.
I see. Let's see. Can melatonin be used every night? Sorry to go back to this, but
yeah. So there are not a lot of long-term studies, but there are a few intermediate studies, and so far they've shown it to be safe. But you always you don't want to find out 10 years from now that it has some significant side effect. So again, I think it's important to talk to your doctor if you've been taking melatonin for long. I think among all the different medical interventions for ADHD, for sleep, it has shown to be safe in the short term. But again, it's not something that you want to take forever.
Right. It's interesting. This one parent, I just want to close the book on melatonin. We've been told children shouldn't take melatonin. Do you disagree? It's interesting.
I do. My colleague, Dr. Margaret Weiss, has done a very important study of children with ADHD who had stimulant insomnia, and showed the dramatic effect of melatonin on their sleep duration. And there have been a number of studies, especially out of in Holland, showing to be extremely effective and safe. So,
okay.
Compared to there's always relative benefits versus harms. And ADHD is not a benign disorder, and sleep problems are not benign. And when you think about the impact on your academic functioning and on your social functioning, it's huge. So again, that needs to be factored into the equation.
Mm-hmm. There are lots of adults here who are saying, yes, okay, I get to sleep for a couple of hours, but I can't stay asleep. And they say, how does one deal with that? I don't.
Yeah.
So
I think everyone's different in terms of the reasons that they can't stay asleep. And you have, just like the slide I showed where I had factors in the child, factors in the parent, factors in the teacher. So you need to look at what are the factors in the adults, what are their medical factors, what are their lifestyle factors, what are their environmental factors, and come up with a plan to address those and seeing if that can impact why they're waking up repeatedly. Is it because of noise? Is it because they need to go to the bathroom? Is it because of a different medication? Is it because they're worried about the things they didn't get done during the day, and then taking steps to solve those things?
Right. One quick last question. A couple people have asked about, are there any vitamin supplements that might improve sleep? Perhaps, I don't know, I'm thinking maybe a vitamin deficiency. If that's discovered, I don't know how that would affect sleep, but I thought I'd bring it, at least ask it.
Yeah, again, I think that's a question that you should ask your internist if they're worried about your nutrition, or they're worried, again, if you have another medical disease that's going on, or disease or condition, you want to treat it. But rather than jumping at supplements, I would focus first on kind of those pro-health behaviors. What is your exercise schedule like? What is your nutrition like? What is your schedule like? And then starting there.
And I feel like I neglected exercise. Real quick,
Okay.
the benefits of exercise on sleep?
Huge, but not right before bed.
Right.
So an aerobic activity, not a couple hours before bed. That wakes you up again.
Okay. Well, I think the hour is up, Mark. Thanks for being here. That was excellent. Really very informative. And I appreciate you doing this for us.
Oh, sure. And really, really good questions. Thank you. Take care.
And thanks for all the attendees for listening in. Once again, today's webinar sponsor is Play Attention Virtual Summer Camp. For more information on the summer camp, call 800-788-6786 or the hyperlink on that initial slide for Play Attention. And please join us next Tuesday, June 8th, when Ann Dolan will talk about how to balance structure with the crazy days of summer for children with ADHD. So it ought to be a good one. Thanks, everyone, for being here, and have a great day.